Come with your friends, as we begin, tunataka kuanza pamoja. Wanafunzi wale wote ingieni haraka, ndio tuweze kuanza hii sensitization of students and mental health issues which affect us while here at the university. We are about to start. Students who are about to get into CS, please fasten your steps so that we can begin. wanafunzi mnaomba kuingia, ndio tuweze kwanza in the next few minutes.
Oui, mais puisque tout le monde le sait, c'est pas mon affaire. Ah oui, je préfère qu'il avait dit. Yeah. Ne vous chagrinez pas. Réjouissez-vous quand même. Yeah. Oui, vive le paysan que je suis. Yeah. Bonne année, mais dans l'autosuffisance alimentaire. Yeah. Bonne année à tout le monde. Super Paquita. Ah, Yaoundé. Yeah. Yeah, your big birthday, Belobo. Mawa. Bonne année, bonne année, bonne année, bonne année, bonne année, Paquita.
127 Savane, Lausanne, Florine Sala, Aline Sala, Neneli Jaffa, Chantal Suisse. Napondelia mingi oyebi tofandi na yango na secteur baibi lelo oyo tokabwana na yo likambo ya soni boye anie zongana nakonga na bondeli ye yaka noki okonsolenga noki nakobeba nzoto mpo nalingi yo Aventure na lekaki epai ya bachantal natunaki yo balobi nanga okelibela nazongaki kinshasa na makanisi mai na miso sekokanisaka yo anika fuka wanga wa molema o Jean-Jacques Fondal Mère Sophie nabondeli yo mingi oyebi tofandi na yango na sekte bayebi lelo yo tokabwana na yo likambo ya soni boye alie zongana nakonga nabondeli ye yaka noki okosolenga noki nakobeba nzoto mpona liyo avant-hier nalekaki epai ya bashanga natunaki yo balobi nanga oke libela nazongaki kinshasa na makanisi mai na miso sefokanisaka yo anika mimuka wana wakolema grand-père Benz Bosibosiana tina kwa mokanda motema efema na elefa yozali wema kwakwa mwanie Isabel Semeki kala ye na jete ya bisele mokolo ya kula mema yetuka na kisasa na poni kwa mona arashedemo mando kiakute wakwelama wema kwakwa mwanie
Good morning. Thank you for coming. This is the time we are starting. My name is Dr. Gujiri Josephine. This is our program for student online sensitization on mental health, a focus on relationships. So we are live in Charter Hall and we have our members online. So according to our program, we have done the registration, and now I would want us to start with a word of prayer, and I would want to invite one member of a student reader council to come and start us with a word of prayer. Karibu.
Okay, good morning, everyone. Okay, I'm Esther. We shall pray. Okay, Abba Father, I come for the praise of this fine morning. I say thank you for the kind protection. Thank you for the good earth. Thank you for this furlough that you brought us. We pray that as we are going to start this sensitization, Lord, teach us, guide us, Father, for your God. We pray, Lord, that you may help us to deal with the problems that we are having for your God. In Jesus' name I pray and believe. Amen.
Thank you very much, Esther. Now we move on with our program. We are behind schedule, but we are going to try and catch up. The next item is welcome and introductions and opening the sensitization. This is supposed to be done by our dean, Professor Frederick Joker. So he is in class, and I will do this on his behalf. So we have our team here who will take us through. We have our counselor, Mr. Henry Atuma, with us. We have Dr. Makena Mureithi with us. Karibu sana. And we have our ICT team. We are full house. We have the students who are here in the charter hall. We have our student readers, and we have our other students with us. So welcome everybody to this sensitization session. And our focus is on mental health and particularly on relationships. So I want to make a brief remark on that and note that it is very important for us to take mental health issues seriously, because just as our physical health, it is important for us to be able to function properly, to be able to be productive, to be able to perform well academically, and particularly that is why we are here in the University of Embu. But we don't want you to just excel academically, and then the other part of your life is in a mess. So that is why we have this session, that we want to carry you on board, that we have many problems that we encounter as students, and how do we overcome them, and how do we ensure that they are not becoming a barrier to achieving our goals that have brought us here. So that is very, very important for us. And the Dean of Student Office and the Dean himself is very keen on having our students get this message and get it on time. So apart from it being something that we have been doing every other time, we are very, very, very concerned that you are taking this message seriously, and this is a program that we are very serious about, because as I have mentioned, we have your well-being at heart, physical and mental. So having said that, I opened the sensitization forum, and without further ado, I welcome our first panelist who will be taking us through this, and she'll be talking about mental health disorders affecting students. She is a medical doctor. She is in charge of our health unit. So definitely she knows one or two, three things that takes you even to the health unit in terms of physical well-being, apart from mental health. So join me in welcoming Dr. Makena Mureithi. Karibu sana daktari.
Okay. Thank you, Dr. Good morning, everyone. Like you've heard, I'm Makena Mureithi from Health Services. I'm happy to have been invited to speak to you on mental health, It's something I'm passionate about, and I'm happy to take you through. So just to start us off, I'd like starting from the point where we define what we are talking about. And so if you think of health, this is a WHO definition. It's the state of complete physical, mental, and social well-being. You can't be well if, I think a lot of us relate health with the physical. This hurts or this doesn't work, like a part of the body. But we are saying health encompasses also your mental well-being and also your social well-being. If you've not had enough rest, you've not eaten well, finances are not good, that affects your health, and we're saying all of that is part of your health and your well-being. So then mental health mental health is a state of well-being where you're able to recognize and realize your abilities and then able to cope with the normal stresses of life. Note that we're accepting that there are stresses, there are things that will happen, bad things that we'd call stressors. And being well does not mean that everything is working out for you, everything is very well. We're accepting that bad things can happen, stress can happen, but then how are you able to work with that? How are you able to cope and still be productive and fruitful in your everyday, in your community, to make a positive impact? That is what we are talking about when we discuss mental health. Now, some of the things that can affect your mental health or the level of your mental health well-being. So, and some of these we've seen, maybe personally or even just all over from the news and when things happen. Violence, socioeconomic pressures, when you experience rapid change, you were used to, I'm sure several of us have come from different places. So you are used to a certain way of life wherever it is you've come from. You're now in Embu, and suddenly, you're hit with a cultural shock. So that might trigger something. Stressful work, or in this case, even school conditions, being discriminated against, and this could be on gender or any other ways that people could discriminate against you and give you some sort of social exclusion. And then again, we've said physical well-being and mental health, those two go together. One can be a trigger of the other. So being unwell might also trigger your mental health. So this being either by something you did, so that's why the unhealthy lifestyle comes in, the decisions that you make about yourself on a day-to-day regarding your health, your physical health, can then also trigger or determine your level of mental health well-being. And then human rights violation, again, also another factor. And so what is it we call mental illness? That was health. And the opposite of health then becomes illness, or you're unwell, when we say you're unwell. And what we call mental illness then is, now, you remember we said mental health, you're able to recognize and realize your abilities and then cope and work productively. Yeah? So now, when there's a significant change in what is expected in terms of how you think, how you perceive things around you, your emotions or your behavior. And these changes then are also to a level at which they affect your functioning in your social arena, in your work or school in this case, or family. Those are what we call mental illnesses. And the list that you see there really is just broadly looking at the type of disorders that can happen. And this is how we generally classify them. It could be mood, and without feeling overburdened, this is really just as they're English words, so don't think they're not very complex when you think about them this way. Mood disorders are where now you have extremities, moods, either sadness or happiness or what we'd call being hyper. Those are classified under that. Anxiety, again, we've said anxiety, there are things that happen and you expect are normal. But now when you go beyond this, in this case, like anxiety is a normal reaction. It's expected that you'll be anxious about things that are to happen, where will you be tomorrow, what happens after you're done with school, what will you even eat in the evening, and those are normal. But then to another extent, they can also now become what we call a disorder. Personality disorders, psychotic, eating disorders, trauma-related, and substance abuse disorders. Now, I'd just like to say that for all of this, the challenge now, and especially with mental illnesses, and even if you just think of these broad things, a lot of them are not things you'll see on the surface, as opposed to, if someone has a broken leg and they walk in here, you'll be able to see this person is unwell, they are hoping, or there's something wrong with their leg. But with mental disorders, they are a lot of times things that are invisible. You might find someone you're very close with, someone you're spending the day with is unwell, and you might not realize that this is happening to them or they're going through something until maybe you're told or you hear from a professional about their diagnosis. So that is usually the biggest maybe challenge with mental illnesses. And I like telling people, so just because you don't know about it does not mean it does not exist, or because you do not see it does not mean it is there, okay? So be very cautious even when now dealing with your colleagues or even with yourself in terms of accepting that there might be something going on for you or for them. And this is just in numbers. Why are we making the big fuss about mental health? Why is it important to talk about it, to keep making sessions or having sessions where we are trying to create awareness about it? Now, as much as you're saying it's something that is really invisible, something you don't see just by looking at someone, if you look at those numbers, it's a big deal. It's increasing, and not just within us, and maybe it's good that even just amongst ourselves, you're able to see how every day you hear there's another case, or I'm sure by now we all know someone who's been affected somehow or in some way by mental health illnesses. So now, without really going into too much detail with the numbers, but if you just look at that, you see our population here covers that 15 to 29-year-olds. And we are saying right now, 20% of the world's children and adolescents have a mental health condition. That is significant. Even if you just think of out of the, let's say, 10,000 even students that we currently have, that's a big deal. And if you also think that now the challenge with not even managing it or treating it and how much resources going to it, that means, lost time in terms of school, in terms of work, what you're expected to be doing. It would make someone, fall behind in what they're supposed to be doing in terms of their coursework. Treatment is also not that affordable. So hence the big fuss. And we're saying it's important that we realize that it's there and do something about it, in terms of even preventing it from happening in the first place. So now, I'll just go briefly over some of the disorders that are common, and you might be able to see what happens with each of these. So first, depression. This is a term we've all maybe at some point thrown around. Today I'm feeling depressed. Maybe even when you were rained on, you were already having a bad day. You woke up, missed class, or you are late for class, and then it rains, you didn't bring anything warm, or you didn't have an umbrella, you're drenched, and the next statement is, I'm having such a depressing day. So we are also saying it's not right to throw some of these terms around. It makes those who are suffering or have the issues then feel that their problems are very trivial, that it's not a big deal. Now, now with depression, first of all, there are various symptoms, And depending on how many symptoms one might have or the severity of their symptoms, it could be classified as mild, moderate, or severe. And these are some of the things. Feeling sad. And maybe just to note, so that the next time you're feeling sad, you don't say you're depressed. The sadness in this case is usually very prolonged. These people might think back even to 2 weeks or even to a month, and they might not come up with one reason or remember any time that they were even feeling happy about anything. So that's, like the sort of degree of sadness we are talking about, not just one day of being rained on or something not going your way at one instance and suddenly you feel, you say you're depressed. Loss of interest or enjoyment. This is particularly in things that you'd usually enjoy or one would usually enjoy, and then they suddenly lose interest. Someone was really into football, was really into basketball, skating, schoolwork or some sort of thing. And then suddenly they don't want to be associated or they don't even have the energy to get up and do any of those things. Disturbed sleep. In depression, a lot of times they'll tend to, it could either be they sleep a lot or it could be insomnia. Insomnia, lack of sleep. But in the depression, they'll tend to have the kind of insomnia or the lack of sleep where they don't do anything that is productive. So they slept usual time, maybe at 10, 10:30. At 1, they're up and they can completely not sleep again. And they wouldn't even have the energy to get out of bed. They'll still stay in, sleeping until, or not sleeping, just lie in bed or just lie somewhere. They won't do anything productive with their wake hours. That's the kind of disturbed sleep pattern you can tend to see with depression. Disturbed appetite, again, this could be either in terms of eating too much or not eating at all. It could be any of those extremes. Feelings of guilt or low self-worth. It could also affect their memory or concentration. They could be in class, but really just staring out. They can't remember even the trivial things, like where you left your keys or where you had them the last time or the phone, such things. And now we said physical and mental health will be intertwined to a point. So at this time, I'm sure maybe even some of us have suffered it. At some point, they have these symptoms that are neither here or there and can't be explained otherwise. So they have pains or some sort of disability, but every test has been done, everything is okay. But they forever have an abdominal pain that cannot be explained otherwise. Sometimes this is because of we call it some sort of conversion. Your brain sort of tricks you or converts that mental health issue that you're going through or that stressor that you're experiencing into, and it sort of becomes a pain that you're feeling. But it's not a pain that is really organic. There's nothing wrong with your abdomen, so to say. They could also suffer anxiety because of now also, again, depression. And we look at anxiety ahead, so I won't go into the symptoms of that. Depression could easily be triggered by adverse life events. We've said everyone goes through things, but we both will cope or react differently to those things. So it could be unemployment, it could be a death of someone close or a loved one. It could be psychological trauma. There are things that happen, and it could be someone talks to you badly or some sort of thing that could trigger some trauma to your brain, and that could lead to development of depression. Okay. So, and like we said before, depression it becomes a really bad vicious cycle. Someone goes into depression, it stresses them some more, it worsens their dysfunction. Then this dysfunction even leads to more stress and more depression. So if they're not supported or they're not well taken care of, it could become a really vicious cycle that really pushes someone down and further that drain. Management, what we do, it could either be talk therapies, what we commonly be called as counseling, but there are several things that happen during those counseling sessions or therapies. And then it could also be through medication. Then we also have what we call anxiety disorders. Like I mentioned before, anxiety is a normal reaction to stress. And sometimes it's even a defensive mechanism. So it could be beneficial in sometimes. When you think of an exam that is to happen next week, and you start thinking, or it makes you anxious, or you get anxious about it, it might trigger you to read some more for that exam. And in that case, it becomes beneficial. It's because you're saying it will alert you to the danger of failing, and therefore help you now prepare and pay attention to what needs to be done towards that examination or CAT or something like that. Now, when we're talking about the anxiety disorders, now these ones are different because it becomes now, other than the normal feelings of nervousness or anxiousness, there's fear and anxiety in excess. Again, also fear, when there's fear and some things will frighten you normally, and again, it will trigger you to take some defensive mechanism, fight and flight, and that is beneficial. But now when it is in excess and it prevents you from now functioning normally or doing what you're supposed to do or lead a product. Sorry about that. So, I was saying, so anxiety or fear is a flight, triggers fear and fight and flight, and that becomes beneficial. But now when it is in excess and it prevents you from being productive, then that becomes a disorder. So even treatment will usually really focus on helping someone lead a normal life despite the fear or whatever it is that triggers the anxiety. So when now do we say this fear or anxiety is in excess? Now there's what is proportional to, this is running out of charge. So when is it that you say now this fear or anxiety is in excess? Now there's what is expected for a certain situation or age. If, for example, a bird flew in right now at, just a few minutes ago, if my reaction was to run out and it has not even come close to me, you'd definitely think now there's something. I'd have an extreme fear of birds. So it has to be, your fear or anxiety, which we are saying is normal, has to be proportional to, the situation or the age, and should also not hinder someone from acting normally. So when it is in excess or now it goes beyond this, then now we say that's an anxiety disorder. And now anxiety disorders are several. There's generalized anxiety disorder. This one will just fear everyday things. They have, just that fear of uncertainty now that we are saying is usual. For them, it's a bit too much. They fear or they tense so much about thinking about what happens tomorrow, and to the point where now they're not even able to function or do anything towards what it is that they realize they can do about whatever it is that is coming up, everyday things. Panic disorder, it could be specific phobias, mentioned the fear of birds, fear of heights, fear of, what other fears? Fear of crowds or being in small spaces, all those fears, those ones now fall under specific phobias. There's agoraphobia, social anxiety disorder, there's separation anxiety disorder. such are what we call anxiety disorders. And again, treatment again could be through therapies, helping people to just cope or find ways to deal with whatever it is that gives them anxiety. And then it could also be to an extent where they need medication to now settle whatever symptoms it is that they're experiencing. We can't talk about mental health disorder amongst our students without talking about suicide. It's not something we like to hear about, but it's something that is happening and something that we've suffered or had to, endure amongst us. We've had several people who have just the thoughts. We've had several who've tried, thankfully and successfully. We've had some who've tried and actually been successful. So, and again, those many numbers there just to say that this is a big problem, not just in our population, but even globally, and we really need to think about it. And there are several ways that it's done and why it's becoming a big deal. On substance abuse or alcohol abuse in this case, this one is the most common even just amongst our students. And abuse, now at this point, we are not saying this person is addicted or dependent on the alcohol. So back to alcohol abuse. So I was saying, when we're talking about abuse, this now, it's being misused, and not necessarily that this person is addicted or dependent. You could use alcohol even once a month, or twice a month, and every time you use it, what you're actually doing is abusing it. You're taking it in too large amounts, and it's now affecting or giving you bad symptoms or making you dysfunctional, the next day. So the effects could be either just from nausea, the vomiting, headaches, giving you slurred speech, impaired judgment, anxiety, insomnia, gives you trouble concentrating, loss of memory. Took alcohol and forgot. Every time you take alcohol, you forget what happened during that episode. Then you definitely abused that alcohol. Okay, it's off. Sorry, just a minute, so that gets fixed. show that this was actually abused. So you realize we're not saying you're addicted or you're dependent on alcohol, but you're acting abnormally with use of alcohol. Now, alcohol use disorder. Now, this is the point where now people are now getting addicted or dependent on alcohol. And in this case, now there's now this compulsion or urge to just use the alcohol. There's inability to control how much or even when you drink. And not drinking now is associated with negative feelings. There's that thing at the back of your mind telling you, please, you need alcohol, you need alcohol. You need to, even when it's inappropriate or when you're not supposed to be taking it. And so we use, again, there's different ways to look at it. Now, so that you determine that this person is now having an alcohol use disorder. There are several symptoms that we look at, and the question then that is usually asked is, for the last 12 months, how many of these symptoms has this person had? And they're not listed here, but they really touch on now some of these 10 things that we are now saying. This person will be neglecting their personal or their family responsibilities. There is an obvious decline in their performance in school, at work. They have symptoms of depression as well. They're having a lot of conflicts with loved ones, and especially those ones that are telling them you're drinking too much or you're not meeting 1, 2, 3 responsibilities because of your drinking. You quickly become their enemy. And they also have some preoccupation with now drinking and get cravings. You're supposed to be in class, but the whole time, even when you make it to class, you're thinking about your next fix or your next drink or how you can walk out of that class. And you even convince yourself it's not so important for you to be in that class. What really matters is to be able to go and have a drink. Unfortunately, at some point it gets to, they try to stop the drinking, but they fail, or they fail at their attempts to stop the drinking. And then there's also now increasing amounts of alcohol to feel its effects. They're initially just taking beers. They've graduated to, what do you call them, zingers and, spirits. They used to just be enough with a quarter. They now need nusu. They now need a whole bottle of it to feel anything. And unfortunately, before it even becomes now this person has trouble, it is the friends who are really psyching them on. Like, hey, let's see how much you can take in or how much you can withstand. And now another one is they get drunk even when it could be a danger, and they really know it is a danger. You're supposed to operate some machinery, or it could even be, sit an exam or do something that is really important, and where it would really be risky to take a drink before doing this thing, or driving. But they still go ahead and take that drink. And then we've already mentioned when they're not drinking, they're having cravings, or they even actually have symptoms because of the withdrawal. And now, COVID-19 times, we really cannot talk about anything without going back to COVID-19. It really dealt a blow to several people, to many people, in many ways, and it came with its challenges also on mental health. Maybe we've also heard of people who suffered, were really generally, like you'd consider them to be well, but COVID-19 happened. It came with a lot of uncertainty, the fear of that disease, and all the effects of the disease, the change of the social aspects. People who thrive on being outside are now being forced to be in the house, unemployment for some people. Such things could also be triggers. Now, we've looked at some of the diseases or disorders that come with mental health issues. So what can you do, or how do you, we're saying there are stressors in everyday life. So how can you try and cope, or how can you try and balance all these things that happen in life? In this case, primarily right now, the big issue for us as students would be you're balancing your school, coursework, your schoolwork, and the social life maybe. So if you look at that arrangement of stones and if they all represent something in your life, now how do you get that symmetry or that balance so that things are not falling over or getting overwhelming? Now, like it stated there, this has to be something that is really deliberate. It has to be something that you decide you want to do and then invest in doing. You have to make that decision that you want these things to work. And it's really about giving proper priority, recognizing that there's all these aspects around you, around your life that are important, and then now deciding the level of importance. There are some things that would be more important than others. And you can think about all the competing interests in your life, and then now decide what is important at this particular time, what do I need to give more time, what gets less of my time, such things. And that is how you attempt to achieve balance. How can you cope? And I'd like you to think of this as both as someone who'd be either you coping as someone who's going through the stresses, or even how to give support to your friends, to those close to you, so that they're also not being overwhelmed. And now, again, back to physical health. I think this is maybe the 5th time I'm saying physical health, mental health, all aspects of health work together to ensure your well-being. So it's also still important that you keep checking on your physical health. We've already seen how physical health or physical illness could trigger mental health, and vice versa. Mental health could also be a trigger to getting now physically ill. And so it's important to maintain an exercise routine, maintain a healthy diet. Your body needs to stay strong so that it's able to, function or give you productivity. It's important to keep those family members close. Unfortunately, we also have to recognize that sometimes they could also be the triggers, but those that work for you, your family members, it's important to keep them close so that they are also a support system. Social life is also important. Create a network of friends, a network of people who have similar interests, who can you can engage in those positive, similar interests together with. Schoolwork, financial, even at this point, the little money or the amount of money, it's not little. The amount of money you get, either as help, as pocket money, or whatever it is, if you're doing something for your income, how do you maintain that and make financially wise decisions to ensure that you're also not leaving yourself at a bad place financially, which could also trigger your mental health. Schoolwork, it's important to, give that the necessary attention it needs so that you're performing well, you're meeting your coursework requirements, your assignments, you're doing well in your exams. It's also important. Getting involved in community work, are there things you can do around you to make the community a better place? Volunteer your time to, worthy causes. That could be also a good way to cope. And spirituality, what fills your spiritual cup? What do you believe in? What is your belief system? That is always a good place to also go back to get energy, to get faith, to get hope, to get through with the things that might be going on in your life. And most importantly, if you're having challenges to do these things, ask for help. Be willing to give help to even those around you. Do not get overwhelmed and then you keep those things inside. And there are many ways. And you'll find someone once said, there's nothing new under the sun. It could really be something that's really stressing you. You don't know how to go about it. But then just talking about it, you realize people have gone through it, have gone through our situations, and there's a solution to everything that you might be going through. And lastly, it's important to take care of yourself. And it's by taking care of yourself that you're able to even take care of whatever it is that is around you, your friends, your family, your interests. But it starts with taking care and good care of yourself. And then a lot of us are going through a lot of things. So when you have the choice to be anything, just be kind, because you don't know what the next person is going through. So with that, I'd like to end there. Thank you for listening Thank you.
Before we forget, you can have a question, then you forget. Anybody? Yes, Esther.
Okay, Dr. McKin, I have one question. How can you help a person who his parents are about to divorce and they have been living a peaceful life? Is there a way this person can help their parents not to break up, or maybe how can you assist that person? Yeah.
A person to her parents. This is a child, it's not a person. Hey, Esther, why are you confused? This is a child who is to help the parents. Dr. McKenna amesikia hiyo. Mwingine, oh yes. Is Max. Yes, Max.
I have one question. How can you help a friend who is undergoing alcohol use or the a friend who is suffering from alcohol use disorder. And another question is that how can you identify someone who is undergoing depression or in early stages of being depressed?
Asante sana. Mwingine hata wale wenye wako nje najua walikuwa wanasikiza. Yes, nimeona mkono pale. Hizi hata mwingine ndani tumalizane hii maneno. Dek. Mkono pale nje ni mkono eh? Ngekuwa ndani ngekuwa rahisi. Nimeona mkono hapa. Yes. Ako wapi? You have a question? Do you have a question out there? Macho yangu ndio iko mbaya, inaona haraka sana. Good. I think the daktari can respond those three questions. Then we proceed.
Thank you for those questions. So, to the first one, Esther. With relationships, it becomes, sometimes you say mambo ya watu wawili ni ngumu, eh? But in terms of how, there's a part maybe I didn't get, you'll tell me if I answer you. Eh? If you're a child trying to help the parents, maybe sometimes the most you can do is to make sure or try not to be the one who's fueling that. There are several ways that could be, you know, but the moment they've decided to go apart, yes, it's important that even those who are affected by that relationship, mostly will be children, are supported to take this. You know, we said a rapid social change could trigger something. So it's very easily that, yes, the children could get affected, and it's important that they are well supported to make sure that they do not suffer, you know, adversely in that separation or divorce process that is going on. Does that answer you? Or were you asking how, I don't know, did I get your question? Mm-hmm. Okay. Now, there are several ways that this child can get help, and at certain different levels. It could either be, you know, first we've said that, yes, it's important that the parents going through the divorce are mindful of those that are affected. And sometimes it could be enough just talking to them, taking them through the process, understanding, you know, it's just between the two of us. It doesn't mean we hate you or you won't get the attention of either of us. But sometimes it could also be to an extent where they need therapy, they need counseling sessions to be able to process that change that they are going through. So it really, there are different ways to help them, depends to the level at which this child understands this process also. Because there's also things with how old are they, how much can they understand of what is going on. Okay. Now, to the question on how you could help a friend with alcohol use disorder, I'd say the number one thing would be, as a friend, you also don't want to be an enabler. Don't be the person who's buying them, you know, or buying them the drink or exposing them to a situation, you know, they shouldn't be in the first place, or, you know, a situation that could help them get closer to the alcohol that they're trying to avoid. Okay? Then, as a friend, it's also good to be honest with this person, number two, that tell them that sasa hapa mali yako imefika, this is a problem and you need help. And if you're in a position to even link them to the kind of help they'd need. And this help could be in a way they could, you know, it could be a counselor, it could be seeing a doctor, it could be checking them or supporting them through therapy, which could even be a rehab center, such kind of thing. But as a friend, it first starts with being a true friend, a real friend. Don't be an enabler, don't encourage it, and then be supportive of the measures they need to take to stay away from that alcohol. Now, on depression, we touched on several, and depression as a type of mood disorder, maybe the first thing you'd be able to notice is an extreme change in their behavior, in their moods, and also behavior. In the sense, remember we said this person, in depression, their mood most of the time will be a feeling of sadness, or they're persistently sad out of proportion of whatever it is that you consider is the trigger. Someone who's very social is now keeping to themselves, is preferring, doesn't have any joy. Someone who was bubbly is suddenly going very quiet, stays away from the thing. Someone who used to enjoy, we mentioned football or whatever it is that they'd enjoy doing. Now this is someone who's becoming withdrawn and keeping away from that. So generally with mental health issues, we said any change that is in the extreme of their thinking, their perception, their emotions, or their behavior, that's the number one maybe sign that you'd be able to see that there's something wrong here. And you might not even be able to, say conclusively as a friend that this person is going through depression, but just recognizing that this person might be going through something and getting them to the point where they say, okay, let's go have this checked by a professional who will now decide what it is that they're having or what they need. You'll have done well as a friend. I hope that answers you. Thank you. I think if there are no more questions, we'll welcome Mr. Atuma to make his presentation with a clap.
Thank you. Thank you very much for this time. I know there are some of you who are watching us live on YouTube, and I can see a few comments from some of them. And like Maggie Amos is saying, she's a second-year student, BSc IT, currently running a foundation known as Nielewe Foundation. They counsel and help students and society at large, especially when it comes to issues concerning mental health. She was further to say thank you for creating this platform to sensitize on mental awareness. Long live University of Embu. Then another one called Tendeka, he says, at times our thoughts can kill us. So I think by thoughts here, I'm looking at the cognitive element of a human being which can influence behavior, where you can withdraw and be isolated. Then at the end of the day, you get to depression, you are sad most of the time, and that may not end well if an intervention is not made. So I want to say that for those who don't know me, I'm Atuma Henry, the students counselor at the University of Embu, and this presentation or this activity was thought about because of the issues that I work with, because of my practice here at the university, and we think that it's important for us to let our students know a few issues here and there regarding their mental health, so that they can be able to know what is offered here at the university, so that they can be aware of what could be going through, and also be able to seek help. I think you know that I'm married. I'm a grandfather, by the way. The son to my daughter is in, you call it grade 4. Yeah, those are things we are learning now. As we used to say, standard 1, standard 2, nursery, you know. But now there's a way you are calling them. My office is at ABH, room 114. Room 114. and that's first floor, and the mobile number for the office is there. You can book a session using that number, 0740 428 343. You can book a session, you can confirm if I'm in the office, because you may find that I may not be in the office at that time when you are coming. I could be in a meeting or somewhere else doing something else. So you can confirm with that. Serem, how do you like this thing? Yeah? Kasawa? Oh, great. Oh, great. So now let me make a few remarks. I think Dr. McKenna has touched quite a bit, which is very pertinent for us. And these are some of the illnesses that some of our students are affected with, and you will find that they require support. So I want to start by saying that, or by asking, whom do you consider to be your family? Who do you consider to be your family? And we may wonder why I thought of picking this topic, mental health in relation to family or relationship for that matter. Now, we know that a family can be a blessing to us. There are those who cherish the family that they belong to, and there are those who dread the family that they belong to. There are some of our students here who dread going home for holiday because it's a curse to go to that particular family. And how is it a curse? This is where you find that this student is not happy with the family that he belongs. It's a family which is hurting. It's a family that traumatizes. It's a family that brutalizes. It violates or abuses the student. It has rejected him or her. It judges him. The student feels abandoned. The student feels banished, looked down upon by siblings or the parents. For one reason or the other, he's scorned, he's vilified, he's let down, he's betrayed, he has no trust. He feels unloved. He or she feels discriminated, isolated, condemned. Because some have been told that they are not worthy anything. Some have been told that by their mothers who gave birth to them, that I wish I gave birth to a djembe. I wish you were a djembe so that I can use it for cultivation, for farming. Some have been referred to as just the umbilical cord or the placenta. That has happened, and particularly when the student feels like there is so much condemnation to him or her. He or she is compared to the others. The others could have had A's and they could have done particular degree programs. But for him or her, that is not anything that comes to him in terms of praise or anything close to that. This is someone who feels ashamed, he feels unvalued, and conditionally loved. Conditionally loved in the sense that it's when he or she can do something that is positive, that they can say, yes, you have done something, but not even, the praise may not be as much compared to his siblings. So we know that we are all social beings, and we relate in one way or the other with others. And actually, the issues that we have, the problems that we experience, are because of the relationships that we have with other people. You can't be alone and say that you can have many issues regarding what you feel about yourself. It's because of the relationship that we have with other people that we have problems or we have issues affecting us. If, for example, you put glasses in a tray, then you move with them, the glasses will produce some sound. They will hit against one another. So therefore, it takes two to tango. And so therefore, our problems are because of the interaction, are because of the relationship that we have with others. And there are various types of relationships that we can talk about. We can talk about relationships with your parents, with your siblings, with your colleagues here at the university, and the relationship with yourself. And how do these affect you and your mental health? Dr. said that it's not that you are sick or you are ill. We are looking at how you feel at that point in time. Are you happy with yourself at that point in time? And so, if you are not feeling happy, then that's an issue that affects your mental health. And we are not saying that you must be happy all the time, but we are looking at on whether you can be able to function appropriately. Can you respond to demands of the school here, academic? Can you respond to social life? Can you be able to cope with stressors that you are faced with from parents, from your colleagues, and the like? So that's what we are looking at in terms of mental health. And you also have your relationship with your lecturers here. Maybe some of us as lecturers give you a lot of stress because we bring cards when you feel you are not prepared. And if you are found with some irregularity, then you have issues around that. You have relationships with your peers. We have relationships with our peers and colleagues to a point that we are even cohabiting. And even when we started to live together, we actually never had anything laid down to say how we want to live. But we just found ourselves together, and that is it. But what we are saying here is that the greatest wealth is actually health. So I don't want to mention what Dr. mentioned in terms of what mental health is, because she has talked about that. But it is being able to, for example, be emotionally stable, you are functioning well, and you are able to do your activities more appropriately. That doesn't mean that you have no challenges. And when we talk about mental health, we are looking at a continuum. So it is not that you have it or don't have it. It's a continuum or a spectrum. And these disorders, I think, as she has mentioned, vary from one person to another. So I don't wish to go to the etiology of mental health illnesses. It has been discussed elsewhere, but I know there are no clear-cut agreement on the cause of these illnesses, like even depression that the doctor talked about. It's not generally agreed on what it is, but it is thought that there are certain things that bring about mental illnesses, like genes, being passed from parents to children, psychological factors, which she talked about, social factors, alcoholism, which she has talked about, and the like. And the issue at the moment is not the cause of mental illness, but the impact it has on the person who is having the illness or the disorder. I would like to mention about those common disorders she has talked about. And so therefore, when you you are encouraged to go for counseling or for therapy to a general practitioner or to a medical doctor or a psychiatrist or a counselor psychologist. And you expect that when you go there, then you will be assisted to heal past emotional deprivations. We have deprivations, or we have our past, which has not been very good, which has been hurting, and we have lived with it for many years. And it can come out later to affect us when we are living or when we are studying here at the university. She talked about transition or culture shock. Some of us, when we joined first year, we don't know what actually happens at the university, and so we can have an issue with the transition. And so therefore, if we are not supported to transit well, then we may have quite a number of issues. So counseling, therefore, is to help us develop specific life goals, manage crisis, help to make decisions, manage current problems, and heal our past emotions. Help resolve or reorganize issues with a maximum degree of self-sufficiency and self-control. By self-control here, you realize that some of us are not able to direct own life here at the university. We would want to be like our peers whom we think are better than us. We compare ourselves with them, and we feel that possibly they are cool for whatever reason. And so we find ourselves getting so confused and get into what they are doing. If it is alcohol or drinking or drug taking, we think that possibly that is the best thing to do because that makes them feel cool. But you wonder what that cool means. This is someone who cannot say no. This is someone who may not be assertive, and he uses a defense mechanism which we call as confluence. He or she is just swayed by the peers because he or she wants to belong. And when you ask why he has to belong, he has no, or she has no particular justification that she has to belong or he has to belong. So these are some of the issues that affect our students. And so therefore, the counseling will help you to adjust or to be able to make choices, of course, after looking at the information that you have before you make that particular choice, and also to take responsibility, Because at the end of the day, when you don't complete your studies, it is you alone who will not complete. It's you and not your friend, because even if you are peers, then when it comes to completion, each one will complete differently. But you could have been in a group that possibly made you not complete your studies. So therefore, it's important for one to be able to take responsibility so that he or she can lead a better life, and also help you to acquire capacity to experience and express feelings and think rationally. Albert Ellis says that a human being has capacity to think rationally or irrationally. And so therefore, to a large extent, we find ourselves thinking irrationally, condemning ourselves for no empirical reason. Why should I feel the other person is better than me? That has no empirical evidence for me to think that the other one is better than me. Issues affecting students that bring them to for counseling. There are quite a myriad of them. There are quite many. But among those, I'll, I think, talk about a few and relate them with my practice here at the university. But just to mention them, some of them have been mentioned. We have drug abuse or alcoholism in the family. And you heard Dr. talk about you being an enabler. Enablers are those who actually inadvertently encourage their family members who could be identified patients that is those who are challenged by alcohol or drugs, to make them continue taking. You are a brother to someone, and that someone drinks, is an alcoholic, is an addict. But when he's caught by police, what you do, because you love him, you want to bail him out of that police cell. So he knows that I have my sister here who loves me, and even if I'm caught by the police, she'll come for me. So she will not get out of that problem that he is in. He will continue drinking because he knows my sister will always come and bail me. So for you, you are being a good sister, but you don't know that actually you are the problem to that brother of yours who takes alcohol, who is an addict, because an addict requires to go through pain. But here you are bailing him out of that particular pain, because if you bail him out of that pain, then he will still continue taking alcohol, and he will always be caught, and he knows that you will go for him and bail him out of that. So they should be allowed to experience the pain so that they can know that it's not easy, and that can help them to come out of whatever behavior that they are having. There are some of us whose parents are actually divorced, and somehow you feel like you may have been the cause to their divorce, and it's something which pains you, and you have never shared with anyone on how you feel about your parents' divorce. You keep the guilt or the blame, and particularly you may realize that you are not the cause to your parents' divorce or even separation, because it is them and not you. But to a large extent, children blame themselves for the differences that they see in their parents, either divorced or separated. Somehow the children take responsibility. Bereavement. Many of us, or all of us, have had some bereavement in one way or the other, and that can be a big thing for a student. And so when you lose maybe a loved one, a parent, or a sibling, there are issues, there's grieving which goes on. And you need to seek support from someone who can help you go through the grieving process. We have many people who have looked at the grieving, and they look at it as in a process, and they have tasks that you can work through. And one of the things that one goes through is shock when a death occurs. And then when that happens, it could be important that you get support from someone who could be professional, or even just relatives, just being around you as a support system. Peer pressure, I think I mentioned that, domestic violence, or childhood trauma. Some of us are suffering because of what happened to us when we were children, and we have never told anybody about that or the effect it has on us. Some of us feel rejected, abandoned. We have low self-esteem. This self-esteem could come from the fact that possibly our parents have said we are not worth anything, and so we now feel like we are not worth anything, and so we have low self-esteem. Low self-esteem has a very big effect on someone. And sometimes we don't even know that that's what actually is making us, say, for example, to feel like we don't have confidence in what we are saying, what we are doing, and so we find ourselves being there. And in connection with that, we can look at love. Love for me is something that I have never known what it is. But I hear people talk about love. People love each other. Yeah, I don't know. But I hear that. I hear some say babe. That babe is a reference to who? To Esther. Who is that? Hey, babe. Hey, Yes, babe. Babe inamaanisha nini? Kipenzi. Unaona vile hata anaonyesha kwa mkono. Kipenzi changu. Babe. But what worries me is that you are calling someone babe and he's hitting your jaw. He hits your jaw very hard and you say, babe, you are hurting me. Anakuonga tena. Na unamuita, babe, I can't understand how he is your kipenzi chako. So this is something that I need to understand. So I think we're living in a world of illusions where we don't know exactly what love is. And because of that, you find that people are suffering in relationships, even here at the university. And then some people think that for them to be loved, then they must allow themselves to relate sexually with so many men, for example. It's never a show of love that you are loved because you are sleeping with a man. I don't know how that is a demonstration of love. Anybody who can help me? So me, I have issues, I have problems, there are things I don't understand. So you will help me as we go on. So we have mistaken things that I think we don't have an accurate meaning about it. We have breakup. Even here at the university, there are those of us who live together in a way that we have no agreement. Sometimes I wonder, people getting to sleep together in the same room, and they're just relating. You can't relate like that if you have no agreement on what exactly you want to do. When things go bad, then you are there, and you have no one to talk to. And you fail to even report to your parents because they don't know. So this is important for you to know so that you can seek help when you are in any problems. Fees payment is a problem or an issue with the students. But however, some of the things that happen is that we get some help from, say, HELB, some parents, but we are not able to manage our finances. There are even students who lie to their parents in regard to their demands. And when they realize that, they find that it's too late and the like. We have sexual abuse, rape. That's a traumatizing thing. And some of us were raped, both men and women, when we were even in primary. And nobody got to know what that is. And the one who raped us was a relative or someone who you know or I know. And I've never said that to anyone. You can imagine that trauma for the last 10, 15 years. And you never got any help then. And that is coming out now. When you have that, when you experience that now, then you are likely to have PTSD, post-traumatic stress disorder, and it has its own challenges. You become immobilized, confused, you can't work to do some things in an appropriate way, and you find yourself avoiding to live with people. You have distressing memories, and you may find like you can actually find yourself passing out, especially when maybe the day when you were raped is the day, comes, like if it was in March 20th, when that day comes, you may find yourself passing out or having some behavior. And people may not understand why that is happening. You may find yourself having difficulties in studies. All these are disorders which may come, and you may have not had any help that time. It's important that you can gain courage in case of any trauma that you may have had to share with someone you trust, which I know is a tall order, but something that it can be done. Some people have, it's both men and women, some people have gotten to a point where they have chosen never, ever to get into any relationship. Is someone who blames self, which should not be the case, because you are a victim. There's nobody who, it's not you asking him to do whatever he did to you. You are just but a victim. There's no justification that you were dressed in a way that was inappropriate, and so that attracted someone to come and rape you. There's no justification for anyone to rape another one. Even if you want someone naked, nobody says that you rape him or her because he or she is naked. Nobody says that should happen. So you don't need to blame yourself or feel guilty for that. But working through that is something that needs to be done. There are those of us who have issues with exam irregularities, gambling, issues to do with the course program. I've talked about time management and finances. And for time management, I'm thinking that sometimes we think that we have so much time here at the university for us to do other things which are not core. But you realize that the program is structured in such a way that you must read, you must have time to read for you to be able to pass the exam well. But because you think there is a lot of time, then it's like, I will read next week, I will read the other day, I will read tomorrow, and you realize that the exam is right here. And when you realize that the exam is right here, you now start thinking of other ways of going about it. We have issues to do with lesbianism, gayism, gambling. And you'll, even pornography. And you'll find that these are what you can call as non-chemical addictions. Non-chemical addictions, like sex addiction or pornography. We have that. And you'll find that if there's someone who has issues with sex addiction, then there is something else, there's another addiction that goes along with that. So you find that possibly he's an alcoholic, and at the same time, he has issues to do with sex. So this, and when we say this, we are not condemning anyone who is in that particular state. We are simply saying that this is someone, if he or she can accept that he or she is in that state, to seek help, and he will get support from a medical practitioner or a psychiatrist or a counselor psychologist. We have talked about that. Anxiety, it has been mentioned. Risk factors, Dr. talked about them. We are protective and risk factors in our life. Like for example, if you come from a family which is alcoholic, then you are likely to be an alcoholic. So that's a risk factor. And I say that sometimes it is good for youth or for young adults to refrain from tasting like a drug or alcohol, because you never know. You could be one of those who is susceptible to becoming an addict. For example, there are actually people who were not meant to even taste alcohol, because some of them, when they taste and go all the way into addiction. So if we knew that, then possibly we could be able to prevent into becoming addicts. So those are protective factors and the like. Uh-huh. Now, I've talked about families. Families can be protective and families can make us be vulnerable because they can mistreat us or can be maltreated by our families. We have people who are abused psychologically by families. And even sexual abuse has been done by relatives. We know of fathers who have had to abuse their daughters severally, and the daughter has never mentioned to anyone. Or the mother may know, but the mother may not tell anyone because of fear on what can follow after that, or fear that the community can make them a laughing stock. So someone suffers in silence. There's one lady who was abused by the father several times. Some time back, she's now over 45 years. Then she ran away to her uncle, and the uncle continued abusing her. She thought she could get refuge there, and she ran away from there, and as we speak now, she has never been married. And she says she will never be married because, according to her, the men are worse than animals. For me, sometimes I think I find animals very intelligent. Because if a cow is on heat, it will be served by the bull, and when that season is over, they go around enjoying green grass. But for men, that rationality is not there. When the id wants, it wants. It wants to satisfy itself. It only wants pleasure. So families, as we said earlier, can be protective, but they can also hurt. I think she talked about poverty and how that can influence our mental illnesses. Some of us, or most of us, come from, I hear people say, humble backgrounds. I think that's misuse of English terms. Why do you say humble background? What do you want to imply? That instead of saying, I come from a poor family. What is humble in poverty? Yeah? What is humble in poverty? Si you are poor, you are poor. Sasa nataka kuipatia madoido ndio ionekane ya kwamba sio mbaya sana. Is actually a poor background. Anything to do with humble, there's nothing humble in. There's no humility in poverty. If you are poor, you are downtrodden. So these have implications in terms of our mental health. Because you get stressed because you know you're not sure of your next meal, your parents will not send you money, and so you even go to your friends to eat, which is okay, You go to the dean of students to support you, which is a good thing. But in your heart, you are so disturbed because you know you can't afford or you don't afford food quite well. Me, I'm one person who actually never, I am from a very poor family. And so when I was in school, I suffered a lot. When I was in Form 5 and 6, I had a good friend of mine who supported me because he came from a fairly well-to-do family. So alikuwa nisaidia sana, sabuni, alafu tunaendelea tu. But I realized that I was so stressed to a point that I could actually vomit blood at some point because of, I was told I had ulcers. Yes, because I carried the family with me all along. I think the mentioned about identifiers of mental illness. I think I'll not mention much of that. For you to identify someone who may be having some illness. And of course, she said that for this to be confirmed, then it has to be done by a qualified practitioner. But what we want to see here is that there are some things that you can observe in your friend, in your colleague student, who is doing things differently unlike before. Who is doing things differently unlike before, and so we call them red flags. So, for example, if you find someone taking excessive substance use, as it has been said, or someone whom you used to socialize with, but now is isolated, and someone who is consistently not functioning very well in terms of academics, is not passing his exams, and we know everyone at the university passed. So what is this that could be happening? So it's just an observation. We are not saying that he or she is ill, but you have been able to identify that there's something that is different. There's some behavior that is different, and possibly then it is you to see how you can support him. I know one of the challenges that we have had before with even my peer counselors is on how to approach someone whom you feel has something that's not very appropriate. So, because you can go to someone and say, I think you have a problem, and he may not be very positive, she may not be very positive about that. So it's important for you to use some techniques or some skills to approach him or her to be able to point out what you are observing. So for you, so you don't appear condemning or judging, you simply, because it's your friend or is a colleague, you may say that, say in the last 1 month, I have been with you and I observe that you possibly these days you don't share with us. There's something you're observing. And don't even ask him what's wrong with you or what's happening with you. No, just say, I've observed that these days possibly you don't socialize with me the way it has been happening before. And that is it. Or these days I don't seem to see you coming to class. Simple. Leave it at that. If he or she has trust in you, he or she will come later and still tell you what it was. So don't ask for an explanation. Just observe, give it back to him or her, and leave it at that. Then I'm sure at some point he will come back for something. Or you can ask if you can refer him or her to maybe to the medical unit or to the counseling unit. So that's what you may have to do. Then we have issues of stigma. Like, for example, if you realize that there are some things which you are not able to have for yourself. For example, food, even rent, or if something happens to you and you feel it's something that is shameful, you may not share with someone because of fear of stigma. So you are therefore encouraged to see someone whom you can trust, that you will keep the information that you are sharing with him or her confidential. Like, I think you know my office, and I know Dr. McKenna's office. Keep information confidential. The aim is to help the student, not to publicize whatever issue or he or she has. So it's important to be aware of that, so that you can come out of that stigma and be able to say issues that you have so that you can be supported. She talked about signs and symptoms to be concerned about. Then one of the things that is disturbing us is fear. Fear has been seen to be false evidence appearing real. Fear, false evidence appearing real. You fear to say what has happened to you because of maybe how people will take you. And all this is in our minds. Whatever you are fearing may not necessarily happen. I think she mentioned this in terms of prevention, educate people at risk so that they can think positively, challenge negative thinking. Challenge negative thinking. There's someone who may feel like he or she is not handsome or beautiful. Mkiniona hapa mnaona kama niko aje? Mnaonaje? Yaani Max, mnaninyamazia kwa nini? Mnanionaje mkiona hapa hivi? Am I handsome? Am I beautiful? Mnaonaje? Yes, we have our own illusions because I've never known a standard criteria of identifying someone who is beautiful. Sijawahi kujua. Mimi mko nayo iko mahali. Iko kwa Google. Standard criteria of someone who is beautiful. Nani ako nayo? Anipatia hapa sasa nianze kutumia haraka hivi. Is there anyone? So, why should you think that you are not beautiful or handsome? Ikiwa mmeshinda kuniambia sasa nani ambaye ni beautiful ama handsome? Kila mtu ni sawa. Yes, but because of what we have in our heads, there are things that we consider and it's like they can put us down, and that is not very positive for us. So we have counseling, which I think I mentioned is confidential, and you need to improve on negotiation skills, solving skills, because sometimes we find ourselves not responding to some things appropriately because of lack of skills. For example, why does someone rape? Kwa nini? Because me I could imagine, ikiwa nimekutazama hivi na nimeona uko poa, nitakuja nikuambie, by the way, you are killing me. Si ndio? Ama mnafanyaje? Mnasema aje? Akiji. Nitamwendea nimwambie you know you are killing me. So please let me know the time. Sio ni mzuri? Akikataa nimwambie sawa tu. Because sio yeye peke yake. Kuna mwingine nitaendea na Mungu atanisaidia. So how do you rape? Yes. So you need to develop skills which will help you to live appropriately. Treatment, psychotherapeutic, she mentioned that. Psychoeducation, she mentioned that. Social education support. Support is very important from the university, from the colleagues, from parents. She talked about medication. She has talked about counseling. She has talked about residential, institutional care. And we have what we call as co-occurring disorders, I think, which needs to be confirmed during time for treatment. Then we have someone called Albert Ellis. He talks about ABC theory of personality. And I've said A is the activating event, B is the belief about the event, C are the consequences, D is the dispute, not the dispute, dispute. E is effective feelings, and F is the new feelings. Suppose mtu akutukana vibaya sana, utamfanyia nini? Nakwambia wewe ni pumbavu sana, wewe ni mjinga, you are an idiot. Utamwambia nini? Nasema ishindwe. Ishindwe. Haya, lakini utakuwa msikia vibaya, sio?
Ndivyo.
Kwa nini?
Inauma.
Aje?
Kwa roho.
Kwa nini?
Ni mambo mabaya.
Sasa hiyo nini ubaya uko wapi?
Ni matusi.
Matusi aje sasa? Sasa matusi gani iko hapo?
I don't seem to possess those things.
Si ndio? So ikiwa you don't possess them, what's the problem?
It is away from the norm.
Hiyo nimewacha. Sasa what I'm telling him is this, I like what he has said. He has been called an idiot, si ndio? But is he an idiot? Is he an idiot? Is he an idiot? He is not. So if you are not, that's okay. So whatever he has said, he amesema na imepita. So the belief you have about idiot is what will bring you problems, is what will bring you consequences. So A is the fact that he has called you an idiot. B is the belief that sasa amenionaje, hii ni matusi. But there's nothing. Does it hold? Do you become an idiot? Do you? You don't become an idiot. So that belief that you have in your head is what gives you problems. I think I've told some group somewhere that one time somebody called me and I didn't know him. And they called me, then I said yes. Then akaniambia hello. Akaniambia hello. Akaniambia unajua wewe ni mjinga sana. Wewe ni mjinga sana. Akaniambia wewe ni mjinga sana. Kumuuliza kwa nini? Akaniambia because unashika simu na hujui nani anakupigia. So what I told him that actually I know I'm stupid. Mimi najua mimi ni mjinga. Otherwise you better tell me something different because that one I already know that I am stupid. Akakata simu. Yeah. So what are we saying? The belief is what brings you problems. Then D is a dispute. But before you dispute, we have 3 more Ds. The first D is detect. You detect the irrationality. You detect the rationality. Then another D is to debate about that irrationality. Like for example, Amito Mjinga. He's not stupid. So what about it? Then the other D is to discriminate by saying that is not me. And then dispute at the end of the day, and you'll be okay, you'll be healthy. So you will have effective feelings and then have new feelings. Then lastly, we have the Gestalt therapy. This was a therapy developed by someone called Friedrich Fries Perls. He was a German. And he said that the whole is more than its constituent parts. That if you have a full loaf of bread, then ukatakata hivi ukipatia watoto, some pieces will fall. If you are to collect that loaf, you can't get the whole of it. So what are we saying? When you are dealing with a human being, you are looking at the whole of that particular person. Not look at you like as a student. That's one element of you being a student. You are also a son of someone. That's another element. So if we do that compartmentalization, then we'll lose you. So we need to take the whole of you and work through with all the feelings that you have, all the behaviors that you have, all the issues that are affecting you as a whole person. And that's when we can be able to help you. And he also looks at the fact that the past is gone, the future is yet to come, and therefore we need to look at the present, that is the here and now of you, what you feel now, because that's what's affecting you now. Somebody could have called you a cockroach. Unajua cockroach? Unajua cockroach? Cockroach ni mbaya sana. Ina uchafu sana. Mzee. Ina uchafu sana. Unajua cockroach? Wewe. Unajua cockroach? You are cockroach. Cockroach. Sasa mtu anaweza kuita cockroach and it is 10 years alikuita cockroach and you feel bad now. So you are coming for help now. So one may wonder how that makes you feel bad now and yet you are called a cockroach several years ago. So the past is gone. We don't have to worry about what has passed because it has passed. The future is yet to come. You can of course think about the future, but you cannot particularly determine it. What you may determine is what you are doing in the here and now. So if you came to me for therapy or for counseling, then I'll take you through the fact that you were called a cockroach 10 years ago and you still feel bad about it. So you will realize that you're not actually a cockroach because I may wonder whether the cockroach is female or male, yenye unafikiria yenye iko kwa kichwa yako, ama iko pregnant, ama ni iko namna gani, ni ya kabila gani, and you realize that actually you are feeling bad for nothing. And so therefore, in that way, you need to control your own life. So you reorient your mind in a way that you can control your mind, you can control yourself. And if you're in control of yourself, then you will live in a better way. Because one of the challenges that we have in life is that you may not control the other person, but you can control your behaviors and your feelings that you are having or you're experiencing. So it's for you to be okay with yourself, regardless of what others are saying about you. Oh. So nimesema question and answer, but not that I will be answering the questions. It's now question and answer time, but not asking me questions. Otherwise, thank you very much and be blessed. Asante sana. Kongoi missing. Thank you very much. Dr. Ngunjiri. Hey, si nimemaliza? Lakini mwenye kuna swali aulize. Not me. Asante sana.
Thank you very much, Mr. Atuma, Dr. McKenna, for facilitating this session very, very well. ICT, how do I get the chat? From this one. So as we look out for the questions in the online platform, maybe if you have a question, this is your time. This have been a very fruitful session. Mr. Atuma said that girls sleep with many men when they are stressed. I don't know whether it is the reverse for the men or it is just for the girls. I don't know whether men also will sleep with many ladies as a result. Maybe I was just thinking to myself whether that is the situation. However, it is important to note that we have progressed very, very well. We have brought out the main issues that we may have wanted you to thank you, to see from our end. And maybe this is the time to hear your views from your end. What do you think? Why aren't you going for counseling? Why is there a lot of stigma when it comes to mental health? When you have a flu, when your stomach is aching, when probably you have a learning stomach, when your heart is paining, when you have a broken limb, you go to hospital or you seek assistance. Why don't you seek assistance when you encountered with some of these barriers when it comes to your mental health? When you're feeling extremely sad, probably I should also book a session with the counselor. Now that I encountered armed robbers some few days ago, and I'm still traumatized when darkness set in. I was fond of traveling any time of the day and night. Now I'm traveling during the day when I can see my shadow. So I think I need to also get some help in that way. So now let me go here. Or do we have any question from the audience here? Yes, please. Are we going to get the mic or they ask the question from here? They ask the question from here. Okay, come. Maybe you can start here so that the camera can also capture you.
I have this one question to Dr. Atuma. Just like how Dr. McKenna started by saying kuingilia mambo ya watu wawili ni ngumu, especially those who are in love. How do you help a friend who has cohabited with his or her partner and they are undergoing differences every now and then?
Okay, then let's have more questions so that he can answer all of them at once. Any other question from our audience here? Yes, just come. Thank you.
A question to Dr. Atuma about cohabiting. Do you think the university students are on the right path with cohabiting? Do you think it's right? Yeah, talk about it.
Yes, that question on cohabiting. We have another question.
Okay, I have two questions. One, how do you help a person who has been in a relationship with his partner or a partner, especially to the ladies, then the person gets pregnant and the boy encourages the person to abort and they continue the relationship. And then afterwards, the boy leaves this girl and then the girl becomes depressed. Then how also can you deal with a person who maybe the relationship failed and then he or she goes maybe he gets into many relationships just to recover from the past experiences? Thank you.
Thank you. We have another question there.
My question is general. I would like to know how you know you have attained stability for progressing from maybe one relationship to another. How do you know?
Okay, great. Any other question from our audience? Don't be afraid. Just come up and take the mic. I can see somebody has a question, but you are doubting whether you should ask. Just ask. Okay. I think if you're a bit shy, you can write down. Some are lead here. People are preferring to write to write down. They don't want to be captured by the camera. You can give them behind the camera. You can give them the mic behind the camera. Because we are here to help one another. So that is in order. So who want to ask behind the camera? Okay, yeah, you can be answering those ones. That is in order.
Oh, yes. You see now our problem starts like that. You can now, the hard questions, you can see the hard questions they're asking. Huh? Me, I will respond, what you take is yours. What I go with is mine. Sawa sawa. So let me start with Dr. question, Dr. Ngunjiri. Good men sleep with many ladies. Ama mlifikiria kuwa ananiuliza, alikuwa anauliza kwa njia nyingine hivi, nafikiri aulize kia nauliza. Apparently, yes. And we have hollowness. There is a hollow in the heart, so to speak, if I may use that. There is some hollowness. And hollowness in the sense that one feels like he lacks that kind of true love from others. And so, unconsciously, he will be going for it in that sense. And of course, there has its own repercussions. This is hollowness that someone wants to feel, and sometimes it can be unconscious. And so you'll get someone in relationships, and they may not be bothered much, but they may not be aware of what's happening with them in their lives. They may not be conscious of the fact that they feel hollow in their relationships. So that really happens. And yeah, then it's like, the guy was asking, why are people not going for counseling? Well, of course, they do come for counseling in my office, and but not as many as they could be expected. There are many things about why that happens. One could be that someone cannot think that I can keep confidential the material he or she shares with me. But I've always told my clients, my students, that by oath, I can't release anything. And if I was to release some information, for example, you go out there, you kill someone or you murder someone, then it's realized you are coming to my office for counseling and you're in a court of law, then they may want to possibly to know what was happening in my session. So I'll get a request from a competent court of law, ask me to release that. And of course, it is meant for your help. Same to Dr. McKenna's office. It's only a court of law that will ask something from her. So the information is confidential. One time, I had a student who came and he was telling me that he would want me to help him so that he can go and help a friend who has a boyfriend, a girlfriend. So I told him if they could come, it would be okay. Then he insisted that, no, their time is not going in line with each other. You find that this one is free in the morning, the other one is free in the afternoon, so you can't easily get them. He came the first session, second session, third session. What he was only out to confirm is that I can keep his material confidential. And I got to know this when he was now in the fourth session, when he actually said that it is him. So confidentiality is a key thing. And so students should know that that information would not be released to anyone. Not even Dr. McKenna will release that kind of information. If it is to be released, then it has to be sanctioned by a court of law and, of course, for your good. Because if they realize that you had some mental issues, and that's why you murdered someone, then that can help you maybe get a lesser jail term. So, so that's one of them. And Also, we are not particularly used to going for counseling is fairly new. Counseling is fairly new, and people don't really understand what it is. But out there, people pay a lot of money to go for counseling. So we trust that possibly with time people will know that counseling is important and they can come for help. And more particularly, when it's here in the university, you don't pay me money. You don't pay me for the services that I offer to you. The university is already paying my salary, and yours is just to come, and that is it. But if you find me out there in my private practice, then you will pay. You will pay for that. So you need to take advantage of this. And I've told students before that if you feel angry with yourself one morning when you wake up, just pass by my office and tell me that, Counselor, I feel so angry with myself, and that's okay. And we'll have a session. Or you feel very happy in the morning and you pass by and say, yes, today I'm feeling very happy. I'm not even sure why I'm feeling happy. That's okay. That's all counseling is about. You feel headache, you go to Dr. McKenna. But when you feel headache, you don't pass by and say, yeah, I'm feeling headache, I want to see Dr. McKenna. And that is okay. It should be as normal as anything, as going for a Panadol over the counter. I'm paid for your services. Mine is to offer services. Partly that's why, and why the stigma, yes. Not many of us appreciate others. And because of possibly the way we have been brought up and things we are not used to, so it's like we laugh at others, and it's us who don't know why we are, why it's happening. A student comes to me and before he gets in or she gets in, she's smiling. Akiingia tu hapo kwa mlango. Namwambia karibu and welcome. I did the same thing. Karibu, welcome ndani. Smiling. Lakini kifunga hiyo mlango, tukianza session tunasema, I mean, I won't say that that's what it shocks me, but what I'm saying is that you realize that somebody was hurting, somebody was suffering. But out there, hapa kwa corridor, ako sawa. So come in and be supported. So the stigma is, many of us don't know what really counseling is. We condemn others. It is something that you don't have to mind about because it is about you, and it's you who is going for help, and it's you who will be helped. What others may say about you should not concern you. You came here alone and you go back alone. What is it? Hata mtu akiona huko uji, kwani atafanya nini? Atang'oa hiyo matiti achukue ama nini? Si huko tu. So hata akiona uji ndiye achake kwa ajili huko uji, you still remain the same person. There's nothing he or she will take away from you. So it's for you to say, I want help, and go for it. How can one avoid, this one was from I think from the chat, public chat, how can one avoid thoughts of self? You cannot avoid thinking about yourself. It's okay to think about yourself, but let us not be self-punishing. Let us not condemn ourselves. Let us appreciate ourselves regardless of the weaknesses which we think we have. All of us have challenges in life, and somehow we negotiate them. Let us appreciate ourselves and work towards achievement, as opposed to condemning self. So you can't avoid thoughts, yes, but the belief we have about them is what can bring problems to us. So we need to be positive, we need to be rational, because there's no evidence to say that you are something negative. It's all that you think about yourself. So let us appreciate ourselves and move forward with our weaknesses as we strive to achieve. How do you help a friend cohabiting and they are going through difficulties? Sasa hapo details fulani ambazo unaweza ukanipatia. Wote wako hapa which years? Max? Yeah, okay. Are they are they in third year, fourth year, first year? Okay. Eh. This is why I say that sometimes students come together. You know, they cohabit or they live together as husband and wife. You know, you can't be a husband until you pay dowry, then padri ama pastor awalete hapa mbele, muambiwe sasa. Unajua wakati baba yenu na mama zenu ndio watawaleta mbele. Can you imagine, unaletewa mwanamke mbele ya altari kwa pastor ama padri? Hiyo ndio inafaa ifanyike. So cohabiting is not can we say a union that is possibly acknowledged by even culture or tradition or Attorney General's office or even the church. So one of the things that possibly these people come together should ask themselves, what is it that we want from this relationship of ours, cohabiting, so to speak? What is it that we want? When you question that, then you need to know why you are getting together. It's quite a big challenge because possibly they are coming together with no particular agreement. Like I've always challenged my students, like I'm also going to do the same now by giving you my personal number. Chukua chini, andika hiyo namba yangu. Andika namba yangu personal and private yangu. Ile ingine niwapatia ni ya ofisi ya. Hiyo sasa ni yangu 0712-146-646. Haya. The reason why nimewapatia namba ni na sitabadilisha. Hiyo namba sitabadilisha. Haya, listen very well now. Umechukua hiyo namba? Hiyo ni personal private. Ikiwa mliingia hapa first year and you are in a relationship with a lady first year, ningependa muendelee hivyo, mumalize fourth year, mugraduate. Mukimaliza muende muoane, mufanye ndoa. Mukifunga ndoa, munipigie simu muniite. Sawa sawa? Munipigie simu wakati like a month before mfunge ndoa, muniambie we are having a wedding, so you are welcome. Muniambie sisi ni wale tulikuwa chuo kikuu cha Embu, tulianza uhusiano wetu tukiwa first year na tumeoana, tumaliza university na tumeoana. Leo harusi yetu itakuwa siku fulani. Munipigie. Sawa sawa? Tuko pamoja. Nimewaambia munipigie simu. Sawa? Sitabadilisha. What am I saying? Relationships at this level may not be mature relationships that possibly may end up into marriage. So you get yourself into a relationship that may not be appropriate. This is why I think I was saying that you're in a relationship and your parents don't know. You even have a child, the parents don't know. Na wewe hata ujui anyone wa huyo partner yako, the one you are cohabiting with. Haujui anyone, hata jina yako unajua tu moja. Kwao haujui. What kind of relationship is that? So it's important for you to interrogate what you are getting into. So to help them, they allow them to possibly interrogate their relationship and possibly see what they can do. No, there's so much. There are so many dynamics. You are a fourth year and you have a first year who is your girlfriend, for example. Sasa unajua first year ameshtuka na anataka amesema akiwa first year kwamba mtaoana and you are a fourth year. Na haja ingia ni first semester tu. Si ndio? Hajaona kitu. Sasa wacha ashtuke. Unafikiri mtaendea mpaka fourth year yeye akiwa first year na wewe ukiwa fourth year? Okay. We have experiences where someone has educated a lady amemlipia fees. Sasa wakati wa graduation akienda anapata anaenda na mtu mwingine na yeye anarudi nyumbani. Na hata kwanza alikuwa ameolewa. Akikuja shule alikuwa ameolewa. So it's very intricate. You need to be mature and interrogate what you are getting into or what you are in. Hey, sasa huyu mwenye anauliza, do you think it's right for university students to cohabit? Hey. Hii ni chawa pia counseling. Sasa ni swali ngumu. Hata wewe huwezi ona ni mimi uacha tu kuuliza swali ngumu kama hiyo. Now, I may not talk about cohabiting being right or wrong, but it has its own dynamics. Because when you are cohabiting, there is so much which can come out of that. What is it? That a child can be born. Even before the child is born, the lady can become pregnant. And when she becomes pregnant, the two of them have not planned for anything around that pregnancy. Nothing. Kwanza hawana pesa. Pesa ni ya mzazi. Help inachelewa, hata itoshi. Chakula ndio hiyo, iko na shida. Rent ndio hiyo. Ukiwa pregnant, I've not been pregnant myself, but I'm told, kwanza my wife, niwaambia I'm married, my wife huwa ananiambia kuna vitu naona inafanyika kwake. Anaweza kuwa mgonjwa for 9 months. Daktari sijui what happens. Mtu anakuwa mgonjwa tu hivi for 9 months. You may have to explain that later. Tujue nini. Anakuwa mgonjwa 9 months. Ile ugonjwa ingine hivi hali ni gani? Akizaa hivi, hiyo ugonjwa inapotea. Tu, huyu mama, sasa ni wewe mnakohabiti hapo. Unaanza kutafuta vitu zingine. Unataka hiyo the fetus inakuitisha maini ya kuku. Maini ya kuku peke yake. Haitaki eti nyama ya mbuzi, maini ya kuku. Daktari ataelezea what that means. Maini ya kuku peke yake. Hata tutoa wapi? Can you afford that, my dear? Then anakuitisha mawe mengine ya kutoka zii Mboni. Kuna mawe fulani ambao pengine kutoka Mboni. Unakula kila asubuhi. Au utatoa wapi hiyo mawe? Mtoto anaanza kuwa wewe unaanza kuwa mgonjwa. Unaanza kuwa mgonjwa. When you give birth, the child has his or her own needs. Ambazo hizo ni pesa. And you had nothing in plan when you are cohabiting. As if hata hamkujua kama msichana anaweza kuwa pregnant. Ni kama hata nyinyi mnashangaa. It mean you are pregnant. Mnashangaa tu. Hata unaanza alafu mwanaume naye anakuwa mjanja anakuambia excuse me. For the last 3 months vile tumekuwa tukiendelea nilikuwa naona dalili zingine ambazo sio nzuri. Ni kama ulikuwa umeanza kwenda kwa wanaume wengine mnakosania hapo. So all this are things that you are not prepared when you are cohabiting. So utawezaje? So practically it's a problem. It's a problem. So I don't know what to say it's right or wrong, but I'm seeing that it is practically a problem. So if you look at that, then also you can make a decision on what you need to do. Kuna ile ambayo alikuwa amesema nini? Esther, ulikuwa umeuliza nini? Kuna kulikuwa na swali kuhusu so uliuliza swali ya what? Abortion. Oh yes. How do you help a girl when asked to abort, akaambiwa atoe mimba, inaitwa kuflash. Inaitwa kuflash. Sasa how do you flash? Flash hii ya tapu haki. Yaani mtoto ni kama maji. It will flash. Is that easy? Do you know the implications of aborting? Hata kuzaa, I'm sure it's intricate. Mimi hiyo vitu mimi naheshimu wa mama, by the way. Hiyo vitu ni intricate. Kuflash, as if ni kunawa maji tu alafu una flash inaenda kwa choo. It will flash. How do you flash a baby? Daktari, they need a better term. Your flash, I think, it may not be appropriate. Yes, it can't be. Those things, your biology ni ngumu, I think. So, sasa wewe unaambiwa utoe mimba. Ndio nilikuwa nauliza, hata kabla hiyo mimba ikue, mlikuwa mmeambiana nini? Sister, ilikuwa ajali? It was an accident. An accident aje na ulitoa hivi, si ndio? Ama ulitoa wewe mwenyewe hivi, ukachukua hivi, ukatoa hivi, then you failed even to use a condom. Because if you must have sex, you even fail to use a condom. So is it an accident? In the first case, before to end the abortion, it's not an accident. Sasa wewe unaambiwa you abort many things. Kuna watu mimi nimeona in life ambao walifanya abortion and they never ever got another child. They never ever got another child. So me, I don't know. Unaambiwa abort. Alafu sasa wewe ni Max, sio? Max amelenga hapa akaona mtu akikuja duniani it can be a difficult thing. So anakubembeleza akiona umetoa anasema we hallelujah. Because hana kitu ambacho pengine kitamfunga ama kitampatia responsibility. So anajua with you amemalizana. Because anaogopa ya kwamba ukizaa there can be evidence ya kwamba ni yeye. Kwa sababu si masikio utaangalia, lakini DNA ikifanywa itagundua ni yeye. Kwa sababu I'm not sure unaweza angalia masikio useme mtoto ni wa fulani. Unaweza angalia masikio? Hiyo huwezi, DNA. So that is it. So it's this is why I'm saying that what is it for you when you get into that? What is it for you when you get into that kind of relationship? So you need to interrogate that. You need to interrogate that before you get into that kind of relationship. Because ukiambiwa you procure an abortion. Sasa in future you are to get married. Mtakuwa mkizaa nini? Nauliza, najua mimi niko na shida na watu. Mnaniangalia in a way to suggest that sio kitu ya kawaida. Nauliza, hiyo abortion mnafanya in future mtakuwa mnazaa? Na ikiwa mtazaa, mtakuwa mnazaa panya ama paka ama sungura ama ndizi? Ama mtakuwa mkizaa mogoka? So ask yourself, why is this man asking me to procure an abortion? How do you get into this kind of situation? So interrogate any decision that you make. Yes. Because that's not an accident. You can't call it an accident. An accident could be, if, for example, you were raped. People can understand that, yes, this was out of rape. Okay, the relationship failed, then it went into many other relationships. That's a very critical question. When you are abort, for example, or when a relationship fails, it's like you are losing somebody through death. So when that happens, you are likely to get into another relationship. So it's advisable that you allow yourself to heal fast Because if you get into another relationship within a short time, you are likely to suffer the same issue. You are likely to have challenges in sustaining that kind of relationship. And the least time you can stay before you get to another relationship, the least is 1 year. So that you can heal, so that you can overcome the challenges you had in the previous relationship. If you don't do that, you'll find yourself getting into many, many relationships within short periods of time. And that can be devastating. And you may even wonder about what you are doing because you may not understand what's happening. So it's important that you actually heal before you get into another relationship, because you find yourself comparing, you find yourself not happy with the next person that you relate with. So you need to heal so that you can stabilize before you get into another relationship. How do you know that you are stable to okay, yeah, so that you can move from one relationship to another. So it's like you are the kind of, you broke. Yes, you broke from the initial relationship, eh? Yes, same thing, eh? It's answered by that you don't just break up and then you get into another one within a week, because that's what happens, eh? Unataka ku either way, lady or gentleman. Sasa nataka kumwonyesha ya kwamba hata mimi asifikirie, ndio? So mnawachana leo, kesho huko na mwingine. That is very very inappropriate. So it's important that you heal so that you can be able to get into another relationship, say after 6 months, 1 year, around that particular time, so that you don't again hurt yourself, because you can be hurt several times. You'll be comparing her with the previous relationship. So it's important that you heal. Thank you very much. I think I've responded to all of them, unless there is a follow-up question. Thank you very much.
Very much, Mr. Tuma, for your feedback and responses. I think now we should be coming to the tail end of this, and it is always very interesting to have this session, question answer. Maybe I can tackle this last one. I hoped Dr. McKenna would, but let me try to answer this one. The question reads, development is subject to environment. Should truth be said that change in environment over being will divert emotional and generally performance, thereby relieving the person? That question is a bit lengthy. It continues. Change in emotion, which can consequently affect performance in every aspect of our being, socially, academically, be dealt with once or stage-wise approach. That is a lengthy question, a little bit detailed. I think the person wants to justify, because the person is saying, thereby relieving the person. So this is called assigning blame. I think, Bwana Atuma, next when we have this kind of a session, is good to give a brief background of how we try to run away from our problems. Justification, assigning problem, just running away. And even trying to mimic another situation. And this is very important. We have the ego. Yes, the defense mechanisms. And these defense mechanisms are very important for us to know them. So I think in our next round, we should, or do you think you want to highlight them? Do you think you want to highlight them? The defense mechanism? Yes, very important. So I'll not even see it, I'll stand.
Yeah, thank you, Dr. Those people who take guidance and counseling, psychology of human development, psychology of learning and teaching, I think I've met that. But let us say this, that we have psychologists who have developed what we call as ego defense mechanisms. And the foundation of that is based on someone called Freud, who had two things. He had the id, he had the ego, and he had the superego. The id is all that we want. At birth, we have it. A child wants to be happy, a child wants pleasure, a child wants to enjoy. And so everything he gets or she gets put into the mouth. That's all the child wants. Even later in life, this is someone who wants just things the way he wants them. The demands are supposed to be met. And now, like for example, like when somebody rapes, actually we know that it is the id which won, and so the ego, which is supposed to mediate between the id and the superego, failed to convince the id, because the id is all demanding. But the ego is rational. It's a logical part of the mind. So when it fails, then it gets into what we call as now the ego defense mechanisms. It has to survive. Like, for example, you have heard of people who are told bad news and they actually collapse. Some even die because of the news. So there, someone may have not been able to say, use a defense mechanism called denial for that time to survive that shock. And they say, no, that's not my mother. No, it can't be. That will help him to survive that. But later with time, he or she may understand, yes, it has happened. So when the ego fails, it now goes into what we call as ego defense mechanisms. An example is a defense mechanism we call, for example, sublimation. Sublimation is where one resorts into a behavior that is socially acceptable. Like, for example, Mike Tyson is one person who was fighting so much in the streets, but he realized that he can be jailed for that. So he changed into a socially acceptable activity, which is boxing, where he had license to kill and cannot be accused of killing, as opposed to when he was in the streets before joining boxing. We have one where, for example, you are following up a lady and umemfuata sana from first year, second year, ifika mahali ukasema hapana, huyu hata si msupu tena. After 2 years, ama 3 years umemfuata. That's a defense mechanism. So these defense mechanisms are not hinged on reality. They actually distort reality. And so they are used where you want to distort reality, where you want to not to be blamed for what has happened, not to take responsibility for what has happened. If you go for an interview and it's like you have failed, you want to say that, anyway, hata hiyo kazi sikuwa naitaka sana, you know, anyway, hiyo sio kazi ambayo ni ya my level, but you went for interview, you failed. So say, yes, I went, but I failed. It's a job that I actually wanted. So these are the defense mechanisms that we are talking about, which are not based on reality. And so therefore, I think as the guy is saying, we need to face reality and be able to take responsibility for whatever actions that we actually do in our lives. Thank you, Dr.
So thank you very much for that explanation. So what we are saying is that we don't want you to not be able to adapt to the changes in the environment because you want to justify that the environment is changing you. So can you aspire to be able to have a stable internal mechanism for you to be able to handle the environmental changes that are happening? So that is the message, in fact, we are giving in this particular question. Now, for this one being one stage or stage-wise kind of an approach, every problem will be assessed according to the severity by the counselor, and then they'll be able to give you the sessions that they think you are able to overcome or you are able to resolve the issue that you have within yourself. So it is not for us to say that if you have a problem, we can solve it now, we can solve it tomorrow, depending on the severity and how long you have been suffering from a problem. Even physically, when you go to a doctor, they ascertain how severe is the disease, and then they are able to give you a program or a prescription that is going to heal you. So it is the same in counseling. It is a therapy that is determined depending on the severity of the illness that you are experiencing. Because we are saying that mental health is just a disease like any other, and we should not shy away from actually seeking help. Now, to top up on abortion, because Dr. McKenna left, you have been told about the impacts and the consequences. For the ladies, you should not be confused by anybody to carry out abortion. You have your own body and you have your own mind. And the fact that we have said that there could have been precautionary measures, and they were not taken. So the fact that you are pregnant, my mother says, let the child come. If the child comes, we are going to deal with that. But don't abort. Don't abort. The same message I would pass today. If you find yourself pregnant, don't abort. Carry the pregnancy. It is 9 months. You'll bear the child, and life will go on. How life will go on will be determined by many other things. But I can assure you, you and the child will definitely survive. And we have had many cases of people getting pregnant while they're in campus, and they complete, they get jobs, they get married, and life goes on. But there are those who will abort, and they hamper their life. They look like they are girls, very pretty out there, they have no children, they didn't want burden, but they have already destroyed their reproductive system. When they need the children most, they cannot get them. So it is important for you to make a decision, you as a person. Don't be coerced. Some people are even threatened. Confide into somebody. And what I have found, because these things are happening in our community, they are happening in our society, you find that if you abort like today, in 5 months' time, that girl is pregnant again. Most of these cases, if your reproductive health was not destroyed, they don't learn a year without bearing a child. Because what led you to become pregnant in the first place, you don't change it. They don't change it, mainly. The unsafe sexual practices, they continue with them even after aborting. But you find now you cannot keep on aborting. Some they go through very traumatic experience during that abortion, to a point of death. Some people have died. So don't be part of that, because there is no hospital where you go and say, oh, I'm pregnant and I'm feeling I want to get rid of the baby. Abortion is not legalized in Kenya. So no sane hospital will give you that kind of service. So you know that when you want to abort, you just go to uncouth people here in the shady street, back street, what we call back street, where you'll be trying to do that. Don't allow your sister, for the men who are here, don't allow your cousins, female cousins, to go through that traumatic experience. Support them. Support them. For the girls who are here, if you become pregnant, pregnancy will not kill you. What may even kill you is the HIV that you may have acquired when you are acquiring the pregnancy, anyway, when you are getting pregnant. That is what will kill you anyway. Yeah? But pregnancy will not kill you if you carry it to term. So I'm happy that now we have come to the end of this, unless, we have a burning question.
Not burning really, but just want to appreciate those following us online, and maybe to mention a few of those. Mbinya Mua, thank you for the session. Kenneth Kipkoril, great session. Maini ya kuku, mawe ya mbooni na niko Busia. Mara mkia ya simba. Utajua haujui. Asante sana. We appreciate you, those following us online. Thank you very much, Doctor.
Or anything coming from the craving, that is okay. So now we have come to the end of this session. We want to appreciate everybody who have participated. We appreciate our facilitators. Our online followers have been appreciated. We appreciate you once more. We appreciate our audience here. We are happy for the ICT. They have done a fantastic job. We thank you all, and we hope that the message you have carried home, it will help you. It will help a person out there. You become the ambassador. So spread the gospel that when you're suffering from stress, when you're suffering from depression, it is okay. It is okay to seek help. It is okay to seek medical care. And I have even seen even our religious leaders go through those sessions where they require support in terms of mental health. So what am I saying? That everybody and all of us are exposed to mental health issues. So nobody is safe. So just be on the lookout. If you feel unwell, seek help. So maybe we can have one of you who are here with us close for us with a word of prayer as we wish you a very good afternoon and a very great stay here in the University of Embu. And we also wish that anytime you have an issue, you have the private telephone number of our counselor here. You can text him, you can call him, you can WhatsApp him, you can Instagram him. You have Instagram? You can Facebook him. You can follow him on all the social media platforms. So feel very, very welcome to do that. And now we can end with a word of prayer from one of us. Wow. Wow, we have two who are volunteering. Thank you.
Let's pray. In the name of the Father, the Son, the Holy Spirit. Amen. Our Father, who art in heaven, hallowed be thy name. May the kingdom come. May thy will be done in heaven as in earth. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen. Almighty Father, we thank you for this session. We ask you for protection, guidance after this session. May it be beneficial to all of us. We ask for your graces in the course of the day. May you continue to be with us. Give us good health and protect every student, the university, and our lecturers. Give us good health, good mental health, so that we can overcome some challenges. In the mighty name of Jesus, we do pray and believe. In the name of the Father, Son,